Hi, everyone. Thank you so much for joining our webinar on the topic of ketamine for bipolar depression. I'm so excited to welcome today's host, Dr. Stephen Mandel, who is an internationally recognized expert and pioneer in the use of ketamine infusion therapy to treat mental health disorders and chronic pain. Dr. Mandel has more than 40 years of experience utilizing ketamine as a board-certified anesthesiologist. He also earned his master's degree in psychology. He is the founder and president of Ketamine Clinics LA, a leading ketamine infusion therapy clinic in Southern California. Dr. Mandel is also founder and first president of ASKP. Sam Mandel is a lifelong mental health advocate and entrepreneur. Mandel started Ketamine Clinics Los Angeles with his father, Dr. Stephen Mandel, in 2014 and has grown the clinic to be one of the most successful and well-respected ketamine infusion therapy clinics in the US. Mandel is responsible for the day-to-day operations of KCLA and manages its staff of 15. He oversees all non-clinical functions, including patient satisfaction, vendors, marketing, technology, development, and finance. When not in the clinic, Mandel enjoys weightlifting, snowboarding, traveling, and spending time in nature. Me too. I love that you added that.
Thank you so much. Thanks for the great introduction.
Okay, so do you want to start off with your location and around the world?
Yeah, I think with such a great introduction from you. I don't know if we needed to say a lot more about us individually, though obviously you can feel free to add whatever you'd like, Dr. Mandel. But yeah, I'm Sam Mandel, Dr. Mandel. We're father-son. We're partners in creating Ketamine Clinics Los Angeles. And we've been doing ketamine infusions full-time for 9 years now, providing them for mental health conditions and for pain, but primarily mental health and a variety of conditions. And we can get into all of those in detail, and especially bipolar disorder for this audience. And we're excited to be here, really excited. We have so much interest in this, and we just really appreciate everyone tuning in. And we're gonna save time for questions at the end. I already see people asking questions in the chat, so that's great. And yeah, I don't know if you want to add anything to that, Dr. Mandel, before we just kind of start jumping into the basics about ketamine in general.
Just an overview. Thank you, Samantha. That was great. Sam, your synopsis was really good and comprehensive. Just to put it in a context, I'm an anesthesiologist. I used ketamine for many years. In the late 1990s and in the early zeros, it turned out that ketamine, an anesthetic I was very familiar with, was profoundly effective for depression, for PTSD, for suicidality, that it worked more quickly, more safely, and a higher percentage of patients than any of the other known antidepressants. And Sam, who, just full disclosure, is not only my partner and a really great guy, he's my son. And I started the clinic in 2014 with him doing all the things he just told you he did, and me doing the medical side of it. And we were a clinic of inclusion, not exclusion. So we took everyone who didn't have a good reason not to be treated. And that included treatment-resistant depressives, chronic depressives, and bipolar depressives, both type 1, who were not manic at the time, and type 2, and numerous other diagnoses. We can discuss them later if you're interested. But you're most curious about where ketamine treatment relates to bipolar illness. So I wanted to give you that context.
Yeah, that's great. And I think just to take a step back and quickly touch on ketamine, there's a lot of misinformation and a lot of different ideas about it out there. So I'd love to just speak a little bit about what exactly ketamine is, what ketamine infusion therapy is, how we've come here to be using it for mood, which is not the primary indication or the initial indication, for this medication. And then talk about specifically bipolar disorder and how helpful it can be. So maybe I'll just share a few quick facts, and you can kind of jump in there as well, Dr. Mandel. But ketamine is an FDA-approved anesthetic. It was synthesized in the 60s. I think it was 63 FDA approved in 1970 and was among the most widely used anesthetics in the world for many decades. It still is among the most widely used anesthetics in the world. Very safe, administered hundreds of millions of times. And it's also used in veterinary medicine. So a lot of people go, wait a minute, a horse tranquilizer or a cat tranquilizer, you give that to people? Yes, because it is a human, FDA-approved human anesthetic, and it is used in veterinary medicine as well. Some people also use it recreationally as Special K, or as I will refer to more commonly, a lot of the time, people self-medicate with it. And that's kind of another, distinction we can get into in a little bit. But people using it on the street, basically. And that's the same drug. Yes, Special K, ketamine, same thing. So we get a lot of reactions from people. And when you might talk to friends or family about your interest in this treatment, if you haven't already, you're going to have people go, wait a minute, Special K, what are you talking about? That's crazy. Well, many medications can be really therapeutic when used in the right context, and they can be less so when not. And ketamine is no different. So yes, people use it that way. That's not its primary use. That's not what it is. That's just one of the ways that some people are using it. It's also an analgesic. So it's used for pain relief in acute pain situations. So it's a very versatile medication. And I think it's important for people to know that. And the use for mental health is a more recent advancement, not super recent. It's been about 22 plus years that there's been a lot of research to support it. And actually some of the early research even goes back much further than that to support a new use for this old medicine. And I could say a lot more, but I want Dr. Mandel, of course, to chime in there too.
I think you're doing great. I want to make sure people understand, we say ketamine. It's a pretty ubiquitous molecule, and it's used in all the ways that Sam just told you about. It's really important. We're going to make some very, very strong claims about its ability to help patients who are suffering. We're not talking about the molecule. We're talking about the molecule used in a therapeutic setting. In a particular way, we give ketamine intravenously via an infusion pump in a clinic. It's got a really good, warm, homey vibe. It's not clinical, it's not sterile, it's not hospital-like. It's got a great vibe, but you'd never confuse it with a cannabis lounge. This is medical treatment. This is not chilling. This is not, oh my God, it's the end of the day and this is my happy hour. This is about relieving afflictions. I make that distinction because how you receive the ketamine and where you receive the ketamine has a profound effect on the benefits you get. And if you hear what we're saying and you get some ketamine and use it your own way, you may not get the same results. This is really closed circuit. Professional driver, don't try this at home and expect the same results. There are many people who self-medicate and get some relief. But if you want to optimize the chances of getting a benefit, you want to go to a professional who gives it via infusion in a clinical setting with adequate preparation for you and adequate follow-up. It's not the medicine. It's the medicine in the context of a treatment.
Yeah, I think that's really, really important. And then, we use hospital-grade monitoring equipment to monitor vitals, and we have an entire clinical team. So we're making sure you're not just comfortable, but also safe. And that's really important. It is actually a very safe medicine when it's used responsibly. It has a great therapeutic index, but really bad things can happen if people take it into their own hands. And with what Dr. Mandel was saying about the way that you take it, technically referred to as the route of administration, also makes a really big difference, not only in the experience, but also in the therapeutic outcomes. So most people who are using it on the street are snorting it as a powder, sometimes IM injection. In the clinic, as he said, we do an IV infusion, and it's a 50 to 55 minute long infusion. That process of a slow, gradual, low dose, continuous for an hour is really key. The neurochemical processes that occur in the brain that are therapeutic, and also to the more psychological aspects of the treatment, which is the experiential component, which you've heard about if you've looked into, psychedelic medicine in general, or ketamine specifically, and the kind of inner work that can be done during an infusion, because patients are often able to revisit trauma in a way that's very therapeutic for them. They're less triggered by it. They're less, hindered by the ability to work through certain challenges with it, or have less of an emotional reaction to certain traumatic memories or thoughts in a way that can help them to work through them, where maybe in the past that material was too painful, or it's been so suppressed, people aren't even consciously aware of it. So the experience itself of the infusion, a lot of things can come up, a lot of healing from the past, a unique perspective on your situation or things that are bothering you. You get to be outside of yourself a lot of the time. There's a dissociative aspect. Ketamine is a dissociative anesthetic. It is very similar to other, psychedelics, and it's commonly grouped in that category with psilocybin, the active ingredient in magic mushrooms, or LSD, commonly known as acid, and other agents, MDMA, which is Molly or ecstasy. And there's actually a lot of very exciting research being done with all of these different molecules now for mental health. But ketamine is actually the only one that is FDA approved and legally available for medical use in the United States today. And it's the only one that has over 50 years of safety and efficacy data behind it. So there's some, key distinctions there. But I guess just to bring it back to the experience, is that psychological component with healing, and then there's also the neurochemical. And I don't know if you want to touch on that, Dr. Mandel, some of the kind of neurochemical reactions going on in the brain that distinguish ketamine from other medications.
I'm glad to do that, if it's useful to our audience. I know a lot about that, and I may know more about that than is very useful to people. And I'd like to
give us a little overview, not too deep into the,
Okay, let's start with really big picture. Whether or not a drug works and why or how it works are two separate issues. This drug works, period. How and why it works is a matter of some conjecture and ongoing study. There are a number of approaches, starting at the most fundamental is the molecular level. What is the molecule doing? You know that nerve transmission is primarily electrical over the course of the nerve, and chemical at the nerve connection, the synapse. A little balloon of chemical floats across from the axon to the dendrite to an end plate, but the end plate isn't an unrelieved plane. It's got little depressions on it called pores or receptors. And amongst the most prominent receptors for neurotransmission is the GABAergic receptor. That is what ketamine uses. All of the other antidepressants are either serotonin or dopamine or norepinephrine. There are four major transmitters. Of the four, the GABA receptors account for about 85% of all the receptors in the body. Just so you know.
It's really important for people to know, as far as, if I've tried a lot of treatments or I've tried a lot of medications that haven't worked for me, why is this going to be any different? Why should this work? And yeah, this actually is a very, very different, aside from the kind of psychological experiential component that I was just talking a little bit about, which I'm happy to get into more later if people want to hear more about that. But there's actually a neurochemical process going on in the brain that's very unique to ketamine that none of the other atypical antipsychotics, SSRIs, SNRIs, mood stabilizers, any of these other prescription medications that we have, they don't work on the brain in this way. So that's important.
That's really important because it's not, when we started out this molecular research, it was thought maybe there was a chemical imbalance in the brain and that these medicines would cause an increase in that particular chemical, such as, for example, serotonin. that would then redress that imbalance. Now, ketamine causes a flooding of the GABA and AMPA receptors, but it's not causing an imbalance. It's actually causing the elaboration of something called brain-derived neurotropic factor, BDNF, which literally causes new growth in the brain. Yeah, you heard me right, new growth in your brain. Now, we don't know that in humans, but we do know that in laboratory models. Without any question, when you give ketamine, areas of the brain, in particular areas associated with depression, which have been involuted by depression, and you can do this experimentally, they grow back, they plump up, and it's just amazing. None of the other agents do that. And you say, well, why does ketamine, which gets out of your body very quickly, why does it last for days to weeks to months? Well, because it actually causes, it starts a cascade of events which lead to new growth. So why does it last forever? Well, because the slings and arrows of outrageous fortune, the buffeting that we get in our lives continues on. And it erodes so that in laboratory models, you see these areas that actually regrew with ketamine. They begin to atrophy and involute again. It's a fascinating process.
It's definitely a treatment, not a cure. And we make that clear to patients, and it's important to know that. And there is no such thing as a cure. With lifestyle optimization, you know, things like healthy diet, exercise, good sleep hygiene, talk therapy, good interpersonal relationships, you know, a good home environment. These things can really help people to have long-term positive effects from the treatment. And the ketamine is really just one really valuable tool in the toolbox of overall wellness. So important to know that. As far as, you know, well, what's the, you know, is there really a lot of weight behind the stuff that we're saying? You know, I don't know if we stated, we've been doing this full time for 9 years. And in that time, we've provided over 14,000, at this point, pretty much 14,500 infusions. That's a lot of infusions. We've done this full time, Monday through Friday, and really been dedicated almost exclusively to this one treatment. So we've refined it and looked closely at it for a long time. But aside from us, there's over 160 research papers published on ketamine for mental health, primarily around depression, some for bipolar disorder, PTSD, OCD, substance use disorders, alcohol use disorder, et cetera. So there's a lot of good clinical research out there, double-blind, placebo-controlled crossover studies, the gold standard in research. Many dozens that are of the 160 that are peer-reviewed. Institutions like UCLA, USC, Cleveland Clinic, Johns Hopkins, National Institute of Mental Health, Stanford, I mean, you name it, any leading scientific institution at this point has published at least one study on ketamine. So there's a lot of great data out there. So I just want to give that context as well, that this is not just anecdotal, this is not an opinion, this is not two guys trying to sell you on anything. It's very real. And I encourage anyone to go and do more of their own research if they like. And there's a lot of great resources on our website as well. So I just wanted to throw that out there.
And your list of you're acknowledging that ketamine is a treatment, not a cure. And you're listing all the other adjuvants that support and extend the benefit is very important, because ketamine is not a standalone. On the other hand, it's very important that people realize that in the depressive phase of their affliction, they are often don't have the motivation or the focus or the energy to implement any of these other things, which they already know would be beneficial to them. Ketamine gives them the fuel and the focus and the energy and the concentration, and very often restores their ability to get pleasure and satisfaction. It also remarkably quiets the bully that's telling you you know, you tried a bunch of stuff. It never works, or it always works for a tiny bit. And then you're back where you started. Why even bother? Ketamine gets rid of that tyrannical voice, doesn't throw it away, but it turns down the volume so that you have a choice of whether you can respond to your urge to get well.
Very, very well said. I want to quickly just clarify what the treatment actually is, and I think it'd be great to move into specifically how it pertains to bipolar disorder, address some of our questions. I see we have about 6 here in the chat. So we talked a little bit about route of administration, IV, the basics of kind of the experience and the chemical processes in the brain. Just to take it a step back and like higher level, we do a series of 6 infusions over 2 to 3 weeks. Each one 50, 55 minutes long. Come into the clinic, fill out some paperwork, some assessments, so we can get a sense of where your mood is. As we have a whole clinical team, we're actually up to 18 now, which is kind of wild. It was just the 2 of us in a tiny little office for a long time. Now we have nice space, 5,000 square feet in Culver City, and 18 teammates. So still wrapping my head around all that. But yeah, so we have a nice office. As Dr. Mandel was saying earlier, we make it a very peaceful, quiet, comfortable space. Our clinical team will greet you, bring you back to a room. We make patients comfortable in a recliner with pillows, blankets, noise canceling headphones, relaxing music, start the IV, run the medicine. We're monitoring vitals and can see and hear you the entire time. And then people rest and recover for about 20 or 30 minutes afterwards, and then go home. No driving for the rest of the day, usually feeling kind of tired or fatigued after treatment, not resuming work or any other strenuous stuff, just resting and getting a good night's sleep. Any lingering side effects like feeling a little dizzy, maybe mild nausea in some cases, these kinds of things wear off in most cases after a full night of sleep. So there's no long-term side effects, short-term are very minimal. So that's just the gist of it in a nutshell for people who might have been curious. So do we want to say anything specifically about bipolar disorder and ketamine, Dr. Mandel, or do you want to look at some of our questions, or what do you think?
Yeah, just let me throw something in there, which may be relevant or not relevant. This is now an accepted treatment, widespread, but not universally. Particularly some of the old line psychiatrists will tell you, oh my God, you're manic depressive. You don't dare take something which might tip you into mania. Well, it was with great trepidation that we started treating manic depressive patients for that reason. One of the very fundamental principles of taking care of other human beings is, first, you do no harm. And we're very mindful of that. We were when we started, we are every time we touch a patient. So we were very cautious. It turns out that when patients are manic, ketamine is not a good idea at that time. And when patients are hypomanic and starting to speed up and accelerate, and it's pretty easy to tell, it's probably best to defer or space out infusions. And when patients are in mixed states and they're flying and they're also miserably down and they're also raging and irritable, judiciously used ketamine can really help to smooth that out. It's not a time to say, oh, you better wait. No, you don't want to wait. Just to put that out there. So when the vast majority of type 1s are depressed most of the time. And of course, type 2s are depressed way more than that. And they really miss out on the fun, and I say that in quotes, that type 1s have. On the speed, on the oh my God, I'm going too fast and it's very exciting and it's very dangerous. But both suffer from a dysregulation in mood, and this helps them with that.
Absolutely. Yeah. And about 83% of our patients benefit, and that's across all mood disorders. So depression, primarily PTSD, that's unipolar and bipolar depression, even postpartum depression, it's actually very helpful for as well. So just within that category of all the mood disorders, about 83%, which is pretty high. Most people are considered treatment resistant when they come to us. So they've tried and not benefited from 2 or more treatments, often many more than 2. Medications or other interventions as well. So it's a very, very effective, very safe treatment. And people usually start to benefit within a week. So it also works rather quickly compared to the alternatives. I don't know if you want to moderate any questions, Savannah, or if I should just open them up and start going through them, or whatever works.
Yeah, there was I know you can't see the Facebook one, so I just want to touch base
Sure.
on the Instagram and Facebook ones.
Yeah.
There's a lot of people asking if they have to come off their other bipolar medication for the ketamine to have efficiency.
Great question.
Yeah.
No, you do not have to come off of your other medicines. One of the mainstays of the treatment of bipolar illness is the provision of mood stabilizers. And the 3 biggies are the Depakote and the lithium and the Lamictal.
Yeah, lamotrigine and Lamictal.
Lamotrigine and Lamictal. There are a bunch of other medicines. The only concern at all is that we not give Lamictal, that you not take Lamictal simultaneous with the ketamine. We find a 6-hour spread between the end of one and the start of the other at both directions is quite sufficient to prevent any adverse consequence. We don't want people to come off of the Lamictal. We don't want people to be destabilized. This is not a substitute. This is an enhancement. Where high dose SSRIs are and some of the adjuvants, we could talk about that, although we like to talk about it with the psychiatrist. We don't mess with people's meds. They've been prescribed by others. We collaborate with them for your benefit and out of respect for your relationship, and also to protect ourselves, because it would be crazy for us to meddle in an ongoing relationship and very delicate chemical soup that's been established over quite time. Bipolar patients are very difficult to get right. And if you've got someone who's doing it even reasonably, we don't want to get in the way of that. We want to help that.
Yeah.
I'd like to add one thing real quick. I'm sitting here thinking, okay, if this is so great, works so fast, I don't have to change my meds. I just have to space out the Lamictal, nothing else. It's so good, so researched, blah, blah, blah. How come I've never even heard of it? How come my doctor's not talking to me about it? How come none of my friends have heard about it? And I want to clarify that ketamine, because it's a inexpensive and generic medication, and you could call it an old one, it's been around a long time, the patent is up. And there's no company that actually really profits much from the sale of ketamine at all. There's many other name brand drugs that have come out that have high margins, and pharmaceutical companies are aggressively selling them. No one really makes money on the sale of ketamine. We can charge a little bit of money for providing a service and actually a treatment with it, but there's not a lot of money there either, to be honest with you. But no one's making money on the sale of ketamine. So no one's really promoting it like they are the other drugs. Also, using IV ketamine in this way for mood is called an off-label use. And this gets into the next part of what I'm thinking that you're thinking is, well, why is it covered by insurance or not? And if not, why? So it is a cash pay out-of-pocket procedure. And the reason why is because ketamine is being used off-label in this way, insurance doesn't want to pay for it. And it's not like there's anything wrong with off-label, but insurance companies love to find a reason not to write a check for anything. That's their MO is, delay, deny. And I hate to say it so bluntly, but that's the reality. And so 1 in 3 psychiatric medications are prescribed off-label in the US, and almost 1 in 4 of all prescriptions are written off-label. Very common practice. All that means is that the drug has been found to be helpful for something other than what it was originally approved for. So ketamine was originally approved as an anesthetic. Us using it as a mental health treatment, as an antidepressant in this way, is just totally backed up and supported, and it works great. It's just not what it was approved for. So insurance says no, no one's really profiting from its sale, so no one's really talking about it. So here we have literally what Thomas Insel, who is then at the time director of the National Institute of Mental Health, said the biggest breakthrough in depression treatment in 50 years. That's a pretty big statement from a guy like that. And here we have it, and yet most people in the medical community, or I don't know if this is actually the case anymore, I wouldn't go this far, but a lot of people in the medical community are not even talking about it. Not nearly as many as they should, and definitely not nearly as many as who should be talking to their patients about it. And that's a little context for you that I think is important to know.
Yeah, and I have another comment about pricing. Is there finance options for people as well? Or is it
So we have several different interest-free financing options. The cost for everything is $3,900. Comes out to about $600 in per infusion. There's a little bit of an extra charge up front. There's no other, testing or fees or costs of any kind. It's $3,900 for the 6 infusions. You pay as you go. If you don't, benefit after 3 of them and you don't want to continue, you don't have to. There's some people it does take a little longer than the 3rd infusion to benefit, but we do have interest-free financing as well. I think the longest one is up to 2 years. So you can, I don't have it off the top of my head, but you can do the math that 3,900 spaced into, monthly payment, 24 monthly payments becomes much more manageable for most people. Some of the options are, working with better credit, some are not, with lower credit scores. And we do try to make it as accessible as we can and still not compromise on the quality of care that we provide, which is very important to us.
Okay, great. Can ketamine help with depression-related insomnia?
I'm sorry, once more?
Oh, sorry. Can ketamine help with depression-related insomnia?
Very much so. And it should be used, but by itself, it isn't enough. Insomnia is the enemy of a good mood. Insomnia will ruin the best treatment, whether it's the best treatment with ketamine or the best treatment without ketamine. Sleep deprivation will destroy it. And sleep deprivation will take normies and make them psychotic in a fairly short time. It's the bane of the mood disorder population. Ketamine particularly can help you with your dreams. And if your depression is partly on the basis of PTSD, your sleep disorder will be benefited by ketamine. But good sleep hygiene is more than ketamine. It's ketamine plus a focus on actual practices that enhance sleep. There are numerous. We could have a webinar just on that. But right now you got to know, you got to lay off the phone, you got to lay off the computer, you got to lay off the TV. This blue light stuff is not just a story. It's really good research. Give yourself at least an hour. The idea that you're going to exercise so that you're tired turns out not to be. You want to start to chill. If you have a meditation practice or a mindfulness practice, you may want to incorporate it into your preparation for sleep routine. You want to go to sleep at the same time every day. You want to go to sleep consistent with your light-dark cycle. 8 hours of sleep is great. 8 hours of sleep from 4 a.m. to noon is not the same as 8 hours of sleep from 9 until 7. It is. So all of those things, but the answer is the ketamine can help a lot. And it's part of a program.
Yeah, I mean, we could do a whole webinar on just sleep, right? I mean, there's so many factors there to what good sleep hygiene looks like. And Dr. Mandel hit, I think, most of the highlights. I would also just add something that I've found very helpful for myself personally is having a really clear divide of what your space is dedicated for. So like not doing work in bed ever, not just when you're trying to go to sleep, but like ever. If you're someone who works from home and maybe you're feeling a little lazy or your mood's a little low and you want to go grab a coffee and get back into bed with your laptop and start doing some work emails or something, not good. You start to associate that space with work and your brain is going in a different way when it comes time to sleep. Again, even if this isn't at bedtime. So keep the bedroom for sleep and other things that it's indicated for and not for work. Stick to that and have a space, and especially working from home. And this is something that a lot of us, I think, are having to deal with nowadays, is the space that you work in, wherever that is really just try to leave it for work. And when you can step away from it, you leave the work there. So you can have a more healthy separation, I think is really helpful.
That's really good to know for myself. I know I'm just so guilty at just scrolling in my bed. So
yeah, I think we all are.
Know.
We all are. It's hard, it's tough, but it's really important.
Okay, so someone was wondering, how high is the mania risk in euthymic bipolar 1 for IV ketamine infusions?
How high is the medium risk?
Is the mania risk?
Mania risk, yes. In bipolar.
Well, we are very we have been very inclusive over many years. We don't tip people into mania. We've had a handful of patients, and I mean literally a handful, and well over 4,000, who said, you know what? I'm starting not to sleep so well. Or, I met a guy and I really thought about maybe just seeing what it would like to go off with him for a little while. And I haven't done that in 2 years. Or I applied to take out a loan and I have been so careful not to do that. And here I am again, it's time to back off. It's time to space out your infusions. And we monitor our patients. We don't just infuse ketamine. We monitor our patients. We're in touch with them. We give them many instruments, including, various psychological instruments ongoingly. And we can see when their amping up starts to subside, and then we resume infusions.
Yeah, I think the number one thing is just making sure we're nowhere near that point when we start. And that comes with just a really good, honest conversation and a good intake process that we have with our clinical team to assess if now is a good time. I can tell you a couple situations that I can think of off the top of my head that were problematic was when people were changing medications at the time that they started their treatment, which is something we always advise against. And we've had some patients who, for whatever reason, they needed to, they had already started that process, their doctors were adamant about it, or for whatever reason, those changes were occurring and we decided that, they wanted the treatment. We decided it was okay to move forward. Some of them, had some challenges, and we, as Dr. Mandel said, we would just need to stop the treatment and resume it at a later time. But that's definitely a big thing. Let's not start changing, mood stabilizers as you're going to introduce a very new effective treatment at that time. Too many different variables makes it really, really difficult. And even in changing other medications, obviously, I'm not a psychiatrist, though I will say that in my experience with bipolar patients, really want to minimize the variables you're changing at one time, because those changes can be significant, and then it can be really hard to figure out what caused what and how we can get things back to a more stable place. So, yeah.
But the answer to the question is, it's not very risky at all if you're being treated by someone who knows the drug. There's a huge variety of ketamine clinics out there. And I'm very conservative as to what I'm telling you can expect from our clinic. This is not universally the case.
Yeah.
Anybody with a medical license can give you ketamine. Not everyone can give you ketamine skillfully.
Yeah, and when we first started in 2014, we're literally one of the first in the country, and people thought we were crazy. Now there's well over 1,000 people offering ketamine throughout the country, and maybe even more at this point, and at least a couple hundred who have made this a pretty big focus in their practice. And when we started, we said, God, we need to make this more widely accessible, and we need basically more people to be doing it. And now we look at each other and we go, we really need to have some quality control here and help people to distinguish between those who are doing it with, integrity and those who are not, or, well-meaning, but don't really have the skills or the training to do it in the way that it needs to be done.
There is a question here. Can ketamine help with creativity? So I also want to add in that a lot of people, they come to me and they're concerned about starting a treatment because they don't want it to affect their creativity. So a lot of bipolar disorder medications that people take want, I guess, their sparkle taken away from them. So I would like to add that, which is what I think they are meaning.
You see people on television every night, literally, who are coming to our clinic to sustain their sparkle, so they have what it is that you're tuning into to experience. It doesn't take away your sparkle. As to its performance or creativity enhancement, I believe that it can. We're in the business of treating people who have an affliction and restoring them to normalcy. We're not in the business of creating an environment where people are striving for hyper normalcy. The crowd in Silicon Valley who's driven to super performance. I don't mean to ding Silicon Valley. It's kind of endemic of what some people think of as the recent American way. But anyway, this and other agents may actually have a role in that, but that's not our area of expertise.
I think, especially if you are a creative person, I would say that it does enhance it. It's not magic. It's not going to make anyone who isn't normally that way just the most brilliant minded musician ever. But, a lot of the symptoms of depression, bipolar, unipolar, and other mental health challenges, it makes it really hard to think in a creative way, to be free. I think, I'm a pretty creative person, and I think of, creativity is as flow and inspiration and being, fully expressed and tapped into yourself and to source whatever that means for you, and having, just flow and creating. And when you're not feeling good, that's difficult. When you're not feeling stable, when you're not feeling safe, and you're having dark thoughts. So just innately, by clearing all that out, which ketamine often does for people, there's room for a lot of the good stuff that was covered up before.
The self-doubt, the second guessing, the, ooh, how am I doing? It's those voices that are crowding out your ability to be fully and authentically you. That's what you bring to the page or to the instrument or to the audience. That's what people came for. That's what you're reaching for. This can get you closer to there. It can't put good stuff there, but it can help you to access it.
So would you recommend, say if someone recently received a diagnosis of bipolar disorder type 1 or 2, should they find their solid medication plan before coming to the clinic, or do you think they can just try ketamine as a substitute for medication?
It's really not a good idea for bipolar patients or any other patients to have themselves as their doctors. Even doctors who are bipolar should not be treating themselves. Doctors who are not bipolar should not be treating themselves. It doesn't work any more than really strong people can lift themselves up by their own shoelaces. It just doesn't work. We don't have eyes in the back of our head. We can't do that. So for the newly diagnosed, they need to have a quarterback. Often that's a psychiatrist. It can, and I use quarterback because I talk to guys who love football. But if that doesn't work for you, don't use it. They need to have someone who can speak truth to them, who they trust, who has a comprehensive view of all the options. Ideally, someone who can prescribe, so they don't have to have too many people on the team. And that normally is a physician.
But to clarify, it's really a case by case basis because, ketamine started out as like a last resort in a lot of people's minds, even though it should not have been, it was, and it's quickly moved up the ranks as far as the order of which you want to try different treatment options. And it's definitely not a last resort, and you don't have to suffer for years before you try it. Whether it should be the first thing or the only thing, that's a kind of different conversation. And I think that we can't really answer that so broadly. It is absolutely one of the fastest acting, if not the fastest, most effective antidepressant available today. But there's a lot of other elements to consider when treating bipolar that are complicated and vary from person to person. And it does require a psychiatrist and other providers, especially those who are expert in ketamine, to figure out what's going to be best for that patient.
But you don't have to go somewhere before you come here, because we can, one of our psychiatrists can evaluate you and help to make a treatment plan.
Right. Yeah, we have 2 psychiatrists on our team who are on staff. And then of course, Dr. Mandel, and then we have other advanced practitioners and nurses. And so, yeah, that's something that any of our team, and by the way, we offer free consultations. So any questions we don't get to today, or anyone who's curious, there's no charge at all to call and just speak with anyone on our team to get information and schedule a free consult with someone on the clinical team, review your treatment history, your questions, specifically for you and your situation, and see if this is an appropriate fit or not. That's all done at no charge. So that's always available if anyone wants.
Yeah, that's great. It sounds like you have a really solid team in the clinic, from just the 2 of you into this beautiful, just working clinic. It's so good to hear that. I do want to answer a few more questions if that's okay.
Yeah, I would love to. Absolutely. I see they keep adding up down here.
They keep adding up, yes.
Yeah, we can also try to keep our answers a little shorter so we can get through more of them for sure.
Okay. I saw.
As you guys probably noticed, we like to talk about this stuff.
You're really passionate, and that shows, and I really appreciate that. And I can tell also commenters are really appreciating that as well. So what is the difference between ketamine and S ketamine in terms of its MOA?
That's a great question. Yeah, glad.
Ketamine is as it naturally occurs as a molecule, has 2 forms, an S form and an R form. A company was able to get the S form patented as a unique molecule, and they market it as a particular intranasal agent for depression. In fact, it's approved by the FDA. It is 1/2 of the ketamine molecule we give, and it is approved by the FDA for treatment of depression. It's a pretty effective molecule. In objective studies in other countries, it works pretty close to as well as the mixture. I say in other countries because it's not legal to give that molecule intravenously in this country.
Just to help people put names to it. So we're talking when this is that molecule, we're talking S ketamine, the left isomer, versus the racemic mixture, which is the left and right isomer.
That S ketamine is marketed as Spravato by Johnson & Johnson in this country as an intranasal preparation. And it's approved for that purpose. And it has utility. Unfortunately, intranasal, whether it's S ketamine or the racemic mixture, is nowhere near as effective for the treatment of depression as intravenous. And that's a fact. And it's sad that economic factors are so getting in the way of choosing the optimum route of administration for helping people with their afflictions.
Yeah, so nasal spray is roughly around 40% effective versus racemic. Most of the studies, and IV, specifically, most of the studies around 70%. we have a higher rate of around 83%. And that's because we individualize the treatment with a lot of nuance in our approach. Whereas in the studies, it's got to be a set protocol, one size fits all. And we know that that's not really optimum for mental health. So the ability for us to kind of tailor the dosage and increase it or decrease it to fit the needs of the patient is one of the things that helps us to get a better result.
And that's another good point. I see a lot of comments of nasal spray not being effective for them. I'm not too knowledgeable on the spray version, but you said you do IV.
Right.
So I think that there was
Very important to see. There's a really scandalous movie going around about ketamine, a kind of a ketamine bashing movie that recently came out, and I'm not going to advertise it, but it shows some of the dangers of ketamine abuse. And all of the abusers in that film are choosing to take it intranasally. And virtually no abuser takes it any other way.
Yeah, I think that's important. You know, you look at the issues with the street use population, you know, some people say, oh, it can cause bladder problems, or ketamine's addictive, or, you know, all these things. Well, the way we're using it, it's about 1/10 to 1/20th of the dose that someone who uses it on the street takes. They're taking a bolus all at once up the nose usually, or an injection in the muscle, all of the medicine at once. We're doing a slow, continuous, gradual infusion. It's the difference between an airplane taking off and a rocket ship, right? And that has a very different effect. They're also often doing it daily or multiple times per week in these higher doses for years before there's any of these negative effects that people talk about starting to be seen. None of those are seen in clinical use in the way that we're using it. So those are some important things, you know, for distinctions for people to be aware of.
Yeah, and following that question, for those with a history of drug use, is it recommended to come in, or is it not a possibility? Would it trigger something within a person?
We've been talking about ketamine here, wanting to address the concerns of people who have bipolar disorder and people who have depression. The original use of ketamine outside of surgical anesthesia was for the treatment of alcoholism, and it's profoundly effective. It's also great for opiates with a really good track record, and for opiate use disorder and alcohol use disorder and many dual diagnoses. It's a tremendous benefit. Also for people who have been abstinent and who are starting to have trouble dealing with their cravings, ketamine is fabulous for helping you to get a handle on your cravings.
Yeah, ketamine's not addictive. Some people might use it as an escape. They might use it recreationally. It's not addictive like nicotine is addictive or opioids are addictive. It doesn't actually work on the body in that way. I mean, some people will use anything as a mental escape. Video games or ice cream or anything can be used in an unhealthy way, but it actually doesn't cause a physical dependency like other substances do when you think about addiction. And as far as drug abuse, if you're someone who's abusing a lot of ketamine, that's a different conversation. Maybe we need to approach that one a little more cautiously about whether or not this is the best treatment for you. But pretty much any other substance, it can help both to get at the underlying reasons why a lot of people are abusing drugs. Often it's to self-medicate, dealing with anxiety, depression, PTSD. So ketamine helps to treat those things. So then there's less of a need to treat them on your own if you're getting relief through this. And then also it can help to curb cravings.
Yeah, that's really good to know. There was just a lot of concern of wanting to try it, but not wanting to trigger a pass or something.
Sure.
Okay. I will do one more question. And you also mentioned that they can call the clinic if they have any personal questions, and there's and consultation. Okay, there's a lot. I'll just pick one more. It's so hard. Okay.
Can I pick one real quick while you're looking?
You can pick one, yes.
Is that okay? I was just starting to scroll through them. I just see that friend. This is from someone I don't know. I guess I don't know if everyone can see her name, so I'm not going to say her name just for confidentiality. But a friend got ketamine for bipolar depression a year ago. He's become depressed again. He said that the ketamine had helped him. Should my friend have a consultation for treatment again? Definitely 100%. Like we said, this is a treatment, not a cure. It's very encouraging that it did help. That's great. And that's very likely to help again. No promises, we make no guarantees. But that person should absolutely have more ketamine under the right context in an appropriate manner with the same provider or another one who can look at those charts, see what that treatment was done, and then go from there, and based on whatever changes are going on in his life today since he last had it. And then all that stuff, talk therapy, and all the other good stuff we already talked about. Hopefully that ketamine can give him the energy and motivation to do that stuff. And then he needs the support to actually do it, whether it's friends, family, therapist, etc. Then he's going to get hopefully at least another year or more of benefit. And we do provide boosters. So we didn't touch on that. So we do a pair of infusions after our initial series of 6. They're called boosters. It's a pair of infusions, usually a day or 2 apart. And that's part of our maintenance program. And that can be 3 months after you finish treatment, 6 months, or in the case of this person, a year afterwards. A year is really good. We consider that a pretty long benefit. On average, lasts around 3 months, but it varies pretty widely. It can be less than that and it can be more. And then at that time, people come back for 2 infusions, a day or 2 apart, and it usually extends that benefit again about as long as it did the first time. Over time, they can usually get longer and longer periods of relief before they need to come back. So a lot of people will just get on a twice a year kind of schedule for maintenance. But again, it really varies from patient to patient.
Okay, great. Do you see any other burning?
Yeah, do you need to stay for several hours or overnight at the clinic? Nope. We do close at 7. No sleepovers. No, people are good to go usually after about 20 minutes, 30 minutes. No driving. Uber or Lyft is fine. We prefer a friend or family member take you home, but people, you might feel like you had a couple of glasses of wine, a little unsteady on your feet, a little out of it, but people are good enough to get home safely, and we don't let them leave the clinic until they are. So 20, 30 minutes is usually pretty good for most people to recover after the infusion. And then we recommend, a healthy meal and a good night of sleep.
Okay, great. I do see a question. My psychiatrist clinic has no ketamine policy. Can you come on your own and get a referral to a psychiatrist? I know you mentioned that you have a psychiatrist in the clinic, so they can come and.
Yes.
Yeah, and there's a lot of misinformation, I'm sorry to say, even among psychiatrists. People don't know. And I feel like it's their job to know, but, we have psychiatrists say, if you go do that ketamine stuff, I don't want to work with you, to their patients. I think it's horrible. That's so wrong. You have to take care of your health. Obviously, you want the professional support in that. And if there's a good basis to try something new you haven't done, and people are saying no, they don't even want to have a conversation about it as to why it may or may not be a good fit for you, and they don't have any good information as to why, and they just say no, I think you should really consider who you're working with. Now, it's not for everyone. And look, I'm not saying that everyone should have it or you should just take matters into your own hands. Work with your doctor. We have psychiatrists here if you don't have a doctor. But there should be a good basis for exploring whether or not this is a good fit with facts.
Okay, yeah, that's really good myth busting there. Thank you for that. And I appreciate how passionate you are about the topic and about your patients in the clinic. It really shows. So I just wanted to appreciate both of you for showing that. Unfortunately, that's all the time we have today. Thank you everyone for joining us. We hope you gained valuable information today. And thank you for our 2 panelists, Sam Mandel and Dr. Mandel, for joining us and showing all your wonderful insights with us. We are so grateful for you. This entire webinar will be streamed on YouTube forever, and I can also email links as well if anyone's interested.
I was just going to say, and if you want a lot of information at ketamineclinics.com, that's KETAMINECLINICS.com, and also 310-270-0625 is our phone number. And you can call, go to the website. We're happy to chat anytime.
All right. Well, thank you two very much. I appreciate your time.
Thanks for having us. It was great. And thanks to everyone who tuned in for all your great questions and for your time.